Ladies, women, let's talk about polycystic ovarian syndrome. Okay, PCOS. It is fluid-filled sac around females' ovaries, and sometimes women mistake it for cyst. It is not cyst. Not all females who have PCOS have cyst. Okay, the diagnosis is when females or when patients come to the hospital, the doctor is going to do transvaginal ultrasound or trans-abdominal ultrasound to see how many cysts are available on their ovaries. When patients also complain that they've lost their periods or they have abnormal cycle, like in the past 3 months they haven't had any period, that's alarming. When they have overreactive androgens where they start getting testosterone boosting up high, getting them to have facial hair, chest hair, even arm hair. We call that hirsutism, very important. That is also signs of, PCOS, or maybe when they have androgenic alopecia. Androgenic alopecia means they start having thinning hair, they start losing their hair, We still don't know the real causes of it. It is genetic. It could be also hormonal androgens, and then also your body also resists insulin. The body resistant insulin is going to cause the pancreas to start shooting up more insulin into your bloodstream, and there's more insulin in your bloodstream called hyperinsulinemia, where the pancreas is trying to compensate the insulin that is not being able to be responded by the body, and in the process of too much insulin in your body, that means there is too much androgens in your body. That means it's also going to cause you to have irregular periods, and then too much insulin in your body is going to be forming fat around your belly area, causing you to also gain weight. That's why patients who have PCOS, they look like they are pregnant and they are not pregnant. Symptoms that I was just talking about, like gaining weight, it causes you to have depression, it causes you to have anxiety. In the process, you also start losing yourself. You're thinking, why am I not able to lose all this weight? And then also your sugar levels fluctuate a lot. From all that pancreas shooting so much insulin into your body, your sugar level keep going up and down, and that's why you're always craving for food. And if you don't pay attention to these symptoms I just named, it could be cardiovascular, where you gaining too much weight could be harmful to your heart. It could cause you to have high blood pressure because of the insulin, and then also too much gaining weight could give you type 2 diabetes. That type 2 diabetes can damage your blood vessels, causing you atherosclerosis. So it's very, very important to pay attention to the PCOS because it could lead to all of that. Females who have PCOS also have cholesterol levels rising up high, and abnormal cholesterol level can build up in your arteries. So these are things we want to pay attention to. Okay, and then the treatment for the PCOS, we could do like exercises to lose weight. Once you're able to lose weight, it's going to also work on your insulin levels, and then also the doctor is going to put you on birth control. The birth control is to help you with your irregular period cycle. It's to just to regulate it a little bit, and then once your sugar level rises up high from the PCOS, the doctor is going to put you on sugar medications or like metformin to help you with your insulin levels or with your sugar levels, blood sugar levels, very, very important. And females who are not able to conceive, the doctor is also going to put you on IVF. The IVF is to help you conceive a little bit. Now, PCOS could also cause acne on the face and everything. So sometimes when females have all this facial hair, acne and everything, we could do the laser hair removal to remove all that facial hair, or the acne is also, we give you some acne treatment. Okay, my name is Nurse Solomon, and